Equisetum Hyemale. This drug is prepared from plant kingdom and it is native throughout the North America, Europe and Asia. Common name of this drug is scouring rush. Family Equisetaceae and prover is Smith. Let us learn something about this Equisetum Hyemale. The main introduction of this Equisetum is that it acts on the urinary organs. The main action of Equisetum are found in the urinary organs. It is mainly used in the following problems: cystitis, then dropsy, anuresis, gonorrhea, hematuria, and glut. Cystitis is inflammation of the urinary bladder. Dropsy, we know that there is accumulation of fluid in tissues resulting in generalized swelling or edema. Generalized is referred to the whole body. Then anuresis, it is involuntary urination. Gonorrhea, it is a sexually transmitted disease and it is characterized by painful urination with abnormal discharge from genital tract. Hematuria is blood in urine, and glut, when there is gonorrheal infection, we see that there is watery discharge from urethra. That discharge is known as glut. So here we can see that the all the problems are present are referred to the urinary organs. Let us come one by one to every part. Urinary system. And here there is severe dull pain in the bladder as from distension, not ameliorated after urinating. There will be severe dull pain in the bladder as from distension, not ameliorated after urinating. Means this pain, this dull pain will be continuous after urinating also, and the pain will be like as there is as when there is distension of the urinary bladder, there is slight dull pain that we feel. The same pain will be here in this equisetum in the urinary bladder, which will be not which will not be ameliorated after urinating. Then the next point is frequent and intolerable urging to urinate with severe pain at close of urination. There will be frequent and intolerable urging to urinate, and it will be accompanied by severe pain at close of urination. Means the person will have to go for frequent urination and he will have intolerable urging, and it will be accompanied by severe pain at close of urination. This symptom is present in other drugs also, like Berberis vulgaris, sarsaparilla and thuja. If we see this symptom, there are 4 drugs that we can see that is present in Allen's keynote. Number 1, Equisetum, then Berberis vulgaris, then sarsaparilla, then thuja. The third and important symptoms include constant desire to urinate. We see that there will be constant desire to urinate with large quantity of urine. There will be constant desire to urinate, and urine will be in large quantity, but there will be no amelioration. After going for urination, the person will again feel the desire to urinate. So here it is written that constant desire to urinate and large quantity of urine without amelioration. But if we see other drugs like Epis and Cantharis, there is scanty urination and it comes in few drops. Scanty, a few drops. This kind of urination is present in Epis and Cantharis. But in Equisetum, we see that there is constant desire to urinate, but and there is large quantity of urine, but without amelioration. So three symptoms we have learned. Number one, there is severe dull pain in the bladder as from distension, not ameliorated after urinating. The main thing that we see here that the urinary complaints are not getting ameliorated after urinating also. Then number two, there is frequent and intolerable urging to urinate with severe pain at close of urination. This is important that the patient feels severe pain when at the close of urination. This symptom is present in other drugs also like Berberis vulgaris, Sarsaparilla and Thuja. Then the third symptom we have already discussed that there is constant desire to urinate, large quantity of urine without amelioration. But in Apis and Cantharis, we see there is scanty and few drops comes while urinating. So here the fourth symptoms. The pain is characterized by sharp, burning and cutting pain in urethra while urinating. So the patient feels sharp, sharp pain, burning pain and cutting pain where in urethra he feels the pain while urinating. Then the fifth symptoms, paralysis of bladder in old women. We see in many of the cases that old women suffers from involuntary urination. It may be because of the paralysis of bladder. So if there is paralysis of bladder in old women, we can think of equisetum. And in this equisetum, we see that the main symptoms that is present in equisetum is enuresis, which is day and night. So and there will be the characteristics of urine is that it will be profuse without amelioration, or it may be of unknown cause. There will be profuse watery urine. So enuresis day and night with profuse watery urine of unknown cause. But if you are taking this point only that enuresis day and night, three drugs are there: argentum nitricum, causticum and equisetum. These three drugs we can see in Allen's keynote that they covers the enuresis day and night. But if it is accompanied by profuse watery urine of unknown cause, we can think of this equisetum. Now comes to the modalities. Aggravation. Aggravation is at the right side. Movement causes aggravation. Pressure causes aggravation. Sitting down causes aggravation. These are the four modalities, means four aggravating things that is causing aggravation in equisetum. The first thing is right side, movement, then pressure, then sitting down. Then amelioration. We see there is amelioration in afternoon and from lying down. See, if we see equisetum, let us remember equisetum with enuresis, E4 equisetum and E4 enuresis. So, and if we go through the whole things, we have come to know that equisetum covers the urinary symptoms, and mainly the enuresis, involuntary urination, and the pain that the patient feels. So, and also it covers the paralysis of bladder in old women. We have also learned some drugs that is covering some of the symptoms of equisetum. So let us again see the whole thing and summarize it. Equisetum hyemale, it is prepared from plant kingdom that is native throughout the North America, Europe and Asia. Common name scouring rush, family Equisetaceae, prover Smith. Smith. Scouring rush as for Smith. Okay. Then introduction. The main action of Equisetum are found in the urinary organs. It is mainly used in the following problems we have discussed: cystitis, dropsy, anuresis, gonorrhea, hematuria, and gleat. Cystitis, inflammation of the bladder; dropsy, edema of the whole body; anuresis, involuntary urination; gonorrhea, it is STD, and it is characterized by painful urination with abnormal discharge from where? From where? From the genital tract. Hematuria, we know that it is blood in urine. Gleat is the watery discharge which is present in gonorrheal infection. So the main symptoms in the urinary system are severe. Number one, severe dull pain in the bladder. Dull pain is severe where? In the bladder. And how is the pain? It is as from distension, not ameliorated after urinating. The whole thing, each and every word is important here. There will be severe dull pain in the bladder as from distension, not ameliorated after urinating. Means after urination also the patient will feel the same dull pain in the bladder. And there will be frequent and intolerable urging to urinate with severe pain at close of urination. Okay, frequent and intolerable urging to urinate with severe pain at close of urination. And other drugs: Berberis vulgaris, sarsaparilla, and thuja. Then constant desire to urinate, large quantity of urine without amelioration. But if there is few drops, scanty urination, the drugs are Apis and Cantharis in case of scanty urination. But in case of large quantity of urine without amelioration and there is constant desire to urinate, the drug will be Equisetum. Then the characteristic of pain that is present in Equisetum are sharp, burning, cutting pain in urethra while urinating. Then the next point, paralysis of bladder in old women and enuresis day and night, and with profuse water urine of unknown cause. The urine will be profuse and watery urine, and there will be involuntary urination day and night. Other drugs that covers the enuresis day and night are argentum nitricum and causticum. Then modalities: aggravation, right side, movement, pressure, and sitting down. Amelioration in afternoon from lying down. So the mainly 3 to 4 drugs that we have learned in this Equisetum that comes in relation with Equisetum. Those drugs are Berberis vulgaris, sarsaparilla, and thuja. When there is severe pain at close of urination, frequent and intolerable urging to urinate. Then if there is scanty urination, there will be Apis and Cantharis. Then enuresis day and night, 2 drugs, argentum nitricum and causticum, along with Equisetum. So let us remember Equisetum with enuresis, Equisetum with enuresis, and it covers the urinary symptoms, mainly the urinary symptoms. And let us remember Equisetum with that there is profuse urination without amelioration. That's all. Thank you.